Well, good afternoon, everybody. Welcome to What's Up Wednesday. This is going to be an open forum for folks who are connected with Disability Network and other community partners to share information, to let us know what's going on, what concerns you have, maybe what's happening in your community, and just to have an opportunity to teach and learn from each other. So welcome. We will be hosting these events every week. That's our intention moving forward, whether it's to promote an advocacy opportunity, to get some community engagement going on, or just, like I said, have an opportunity to connect. Before I go any further, I should probably tell you I'm Terry Robbins with Disability Network. I do a lot of community outreach opportunities, and I'm just really happy to be here with you today. So thank you for joining us. Secondly, that this and future events will be recorded. And so I tell you that in case you share something on there, other people might be able to see that in the future. If this is not a confidential forum, it will be recorded and shared in other venues, might be on FaceTime live at some point, definitely on our YouTube channel. And so I just want to put that out there so you are aware. And before we jump into information, I also just want to let you know immediately, rather than waiting till the end of the show or waiting till another time. If you need any resources at all, go ahead and call our office. Our buildings are closed because of the shutdown, the stay-at-home order, but our staff are working. For those of you that don't know, at Disability Network, we serve 12 counties in Central Michigan. And so we have a lot of services that can help support individuals with disabilities in their home and in the community. So our 800 number is 1-800-782-4160. If you prefer to email, I know I'm an email junkie, it's just info@dnmm.org. That's for Disability Network Mid-Michigan. Best place to find us. Our staff are working, like I said, around the clock, most of us, and so if you have a resource need, please don't hesitate to contact us. So today we're going to be talking a fair amount about resources, some disability rights and things that are going on specific to the coronavirus crisis. We will always have an opportunity for open forum for questions. If you have other thoughts or ideas as they come up during our discussion, feel free to throw those in the chat box. But we will open up the mute. We'll unmute everybody so that we can have some open discussion at every event. Just a few reminders about Zoom as well. If you're not super familiar with it, we have a couple tutorials out there. You can Google. We have a few tips on our website as well. But there's a chat box down below that you can just click on and type information in. Make sure you check to see if it's public or private. You can make that choice when you're in the chat box. So if you want to send a message that only I see, you have the ability to do that, or you can throw something out to the whole group. And there's some opportunity for us to brainstorm together when we do that. So feel free to enter information there. Also, there's a way down on, should be the bottom, I think. There's a little control bar if you scroll to the top or the bottom that gives you an opportunity to change, or to find the chat bar for one, but also to change some settings. So you can unmute yourself if you have something that you want to say. You can share your video so we can see you, or you can choose not to do that. And there's some other controls down there, so feel free to utilize those. We will have some open discussion, and I ask that we just be respectful of each other when that comes up. If there's something that you want to share, please do. We want to make sure that everybody has time to get their 2 cents out there. If you are, not real passionate about that particular topic, or don't have anything to say, or don't want to share, you're welcome to pass. I know some people really take in information, they just want to listen and process that, and then they may contact us later, and all of those are fine. So we want this to be an opportunity for people to get what they need out of it and be comfortable sharing. Also down there on that, somewhere down there, there may be an opportunity for you to to raise your hand if you have a question. Most of the, let's see if I can see that here. I think I only see that in the chat on this one. Some of the web platforms are a little bit different, and we're going to ask about that as well. So I have a couple of polls that we'll be introducing at several of our What's Up Wednesday sessions. We like to get a lot of consumer and community feedback, and so that will be one thing that we do, but also to see what the best way to stay connected with you is. So if you prefer email or newsletters, or if you use Instagram, Zoom, if you have that capability, Facebook, all those kinds of things. So be looking for those, and again, answer what you're comfortable answering, and if you choose not to do that, that's okay too. Okay, I want to jump in a little bit to some of the things that that we're seeing in the media, and just share some information. In particular, everybody's heard a lot about COVID and the coronavirus, what to do, how to protect yourself. But we're in the disability community are hearing some really daunting concerns about the potential for people not receiving care or not being able to receive care. Something some folks have referred to as medical rationing. And so I wanted to share some information with you about that and make sure that you are aware of what your rights are. DREF, the Disability Rights Education and Defense Fund, put out a pretty powerful report, and I think I have that up here somewhere, that I'd like you to be aware of and to reference. And so since the occurrences of corona are on the rise, there was a concern that lawmakers might be making some decisions regarding healthcare, education, transportation, housing, and a whole lot of other critical services that you can see here that would impact the rights of individuals, and particularly individuals with disabilities. They have a whole report that really suggests to lawmakers why rationing care is dangerous. And so I wanted to make you aware of this report. It's extremely comprehensive, and a really great, like I said, a reference tool that helps people think about some of the ethical concerns that come with denying care to anyone. We know that individuals with disabilities in our community may have some underlying health conditions that put them at even greater risk, and we want to make sure that people aren't denied the care that they might need just because they have a disability. They're looking at several different acuity scales across healthcare systems, some that look at the end after treatment, the potential, what the likelihood that someone's quality of life will increase, what their longevity would be, and some of that isn't impacted by the care that they're receiving. And so there's a propensity that prejudgment of what someone's quality of life might be is less than someone else's. And so we take some offense to that. So I wanted to make you aware of this report for that reason. I have a couple other things I want to share with you. One is in regard to our state hotline. Okay, so you can see, let me get rid of my face, why my screen's not sharing for you. But that phone number right there is our national hotline. If you have a disability and you need medical advocacy or other support, this is the hotline to call. Keep in mind that you cannot be denied medical care currently simply because you have a disability. The Americans with Disabilities Act specifically prohibits discrimination, and one of those services that's covered is healthcare. One of the other things I want to bring to your attention is if you were to get sick, one of the things that we're encouraging folks to have is a patient advocate form already assigned, an advanced medical directive, something like that. And so if you are in a situation where someone else needs to decide care for you or determine what services, healthcare services you receive or you do not, that having that patient advocate form completed ahead of time lets your wishes be known. And so we're encouraging people um, to have that completed. There's some information, as I said, on our website on how to do that. Many health systems have their own version. And so we encourage people to complete that. It covers lots of things like, do you want to be on a ventilator? Do you want CPR, for example? But it also helps identify a lot of other measures. Obviously, you can't think about every single situation that might come up. Every illness is a little bit different. Every health condition is a little bit different. So it walks you through some of those scenarios. And like I said, really lets you identify what you would like in some situations. And that helps people and your primary care physician plan your care moving forward. We recently sent a letter out to a number of folks that we provide support to and some of our community members. And just wanted to put some folks' minds at ease a little bit, to let you know that, that we are here, we are working, and that if there are things that you need to go ahead and give us a call. I mentioned our 800 number already, but I will again, it's 800-782-4160. You can always go to our website and let us know if there's anything that you need as well. There's a place for you to, so, you know, contact us kind of data entry thing right there on our website. So we also sent out this information sheet to let people know where they could get additional information. Our Michigan.gov, which is our state site, has the most up-to-date information about coronavirus. That's local. Obviously, the CDC has some nationwide information. But we wanted to share some resources as well, whether it's for yourself or a loved one. The state has also opened up what they call a warm line. And it's not 911. It's if somebody is really struggling. Sometimes this is an emotional time. Things can feel really stressful and overwhelming. And you might just need someone to talk to. And so that warm line has been established. It's staffed from 10 a.m. every day until 2 in the morning. So a lot of times that evening time when it starts to get dark and there's, you know, the Netflix is going down. You've seen everything on there, and sometimes you just need someone to chat with. So that number is there for you to call. It's 888-PEER, like you need a peer support to talk to, PEER 7533. So 888-733-7753. And then if that does progress to a point where you feel like you may do yourself harm, you can call the National Suicide Prevention Hotline. And that number is 1-800-273-8225. I already mentioned to you the medical advocacy hotline that exists. And again, that's a national hotline. If you feel like you're going to be denied medical care, you're in a situation where you need some assistance to advocate for your care and support, particularly because of the coronavirus or COVID-19, that number is 800-626-4959. And we encourage you to use those resources when you need to. Also just want to remind folks that we are here for you at Disability Network. Like as I mentioned earlier, we are working, our staff are available for you. So even if it's not particularly regarding a healthcare need, we provide 5 core services on a regular basis, and our staff are, like I said, taking calls right now. So our 5 core services are listed on the screen. Our information and referral department is really there to help find resources that you might need. You might be experiencing a disability for the first time and not know what kind of supports or resources are available. Or you might know of a neighbor or a family member that's struggling. You might just have questions about Medicare or Social Security and how those are going to be impacted by whether retirement or employment or a new healthcare need. So feel free to call us and ask those questions. Might be how to use the bus system in your local area, looking for affordable housing. Maybe you feel like you've been discriminated against and need some support. We can help with all of that. The second core service listed is community transition services. We help individuals move back into community. Sometimes folks might be moving out of a nursing facility or want to move out of a nursing facility and not have the supports to do that. Might not have a home to go back to. And so we look for individuals who are struggling. We don't want people to be stuck in a situation that they don't want to be in. And so we help people regain their independence in that program. We also have a peer support and mentoring program. If I mentioned earlier that warm line, this is a local opportunity for you to connect with folks. One of our core beliefs is that people with disabilities are truly the experts in their own lives. And so sometimes you want to talk to somebody who's overcome some similar obstacles that you might be facing. And so we can connect you with an individual who's kind of been there, done that, and give you an opportunity to talk one-on-one with them. We also have groups that get together, groups of individuals with disabilities who support each other, whether it's through a community activity or just getting together to talk about some things that are going on in their community. Currently, we have some virtual groups meeting, and you can find information about those on our website as well. We just really want to make sure that folks are getting connected and getting the support that they need. We also have a skill development program, and if you or someone you know is interested in learning some skills to regain or gain their independence, it might be someone who's acquired a new disability and has to relearn how to do things in a new way. Or it might be someone, for example, a youth who's getting ready to move into their apartment for the first time and maybe hasn't had the same opportunity to learn life skills as someone else. It could be somebody that is looking toward employment and wants to build some of those soft skills or prepare a resume, things like that as well. Pretty much whatever it is you feel like you need to learn or develop. We have a lot of creative ways to help people with a variety of learning needs develop some of those skills. So feel free to give us a call. Again, some of that is one-on-one. We have some classes and programs that can be done in a group setting if you're more comfortable with that. Right now, we even have some stuff online, so I'm sure there's an opportunity there for you. And then we also have a pretty strong advocacy program. So I mentioned earlier, if you feel like you've been discriminated against, you can give us a call. We also work on some systems advocacy, so more of a macro, we need to make a change in our community or a public policy. And you can get involved in those efforts as well. We encourage you to give us a call. I mentioned earlier that community feedback is really very, very important to us. So if you have ideas about things that you'd like us to be doing, please absolutely let us know. We are here for you. See if I can get my lovely screen back here again. I think I need to get one of those little mascots that goes, "What's up?" And we'll have him pop up every day. So this will be available for you to access at a future date, as I mentioned. So if you need to go back and pull up one of those numbers or one of those resources, feel free to do that. This really is quite a large effort in regard to supporting individuals with disabilities through this healthcare crisis. Not only here in Michigan, but globally. Just recently, 6 nations came together to form something called the Disability Rights Monitor for COVID-19, and they really recognize the impact that this pandemic is having. It says evidence is emerging that persons with disabilities are being disproportionately affected by the coronavirus pandemic, and emergency measures are being taken by governments worldwide. As governments rush to respond to the virus, it's more critical than ever to guarantee that measures taken are fully inclusive of persons with disabilities and prevent human rights violations from taking place. I was really struck by this. I think sometimes in the United States we recognize and hope that human rights are honored and people are dignified and valued for who they are. We know that in society that's not always equitable, and certainly globally. So for this group, this statement to come out and them to recognize the value of individuals with disabilities was very moving. Again, it's COVID-19 Disability Rights Monitor is the global movement. But if you have questions about what's going on or how health services are impacted in our area, or if you need help or support at this time, like I said, I would encourage you to give us a call. I think because our numbers are small today, I'm going to forego some of the polls that we have. I did have a few questionnaires pop up there for you, but I will save that for our live sessions. And that will be all I have for today. I'm going to open up the floor in case anybody wants to add something.
Where am I?
Hi guys, how are you?
Hi, Terry.
Hi. Hello. I saw a couple of you snuck in a little bit later, so.
Yeah, very good information though.
Yeah, I added a little bit at the beginning about just some of how this format is going to work as well, but I wanted to just make sure folks had some information about, again, the healthcare crisis and how we're addressing it, and mostly that we're here to help.